Hi there, I'm Todd Bauer, and I'm very excited to share with you a little bit about myself and my passion for providing excellent care to patients. I've been in a community-based oncology practice in Tennessee for just over 12 years now, and have watched the evolution of personalized medicine during that time through the lens of both a phase 1 clinical trialist and a general medical oncologist. Over the next couple of minutes, I'm going to share a little bit of history with you that will help you to understand why I'm so passionate about educating and empowering other clinicians about how to optimize genomic testing to help find personalized and targeted therapeutic options for patients. I can honestly remember sitting in tumor board as a fellow and hearing the phrase anaplastic lymphoma kinase, or ALK, fused lung cancer for the first time in 2009. As time has passed, a better understanding of tumor biology has certainly driven the opportunity to develop more targeted therapies, but we've needed a highly efficient way of finding those targets in our patients. The evolution of broad-based next-generation sequencing over the past decade has facilitated this. On the forefront of this tide was high-throughput, broad-based molecular profiling, often called next-generation sequencing, or NGS. This technology has allowed us to test for hundreds of mutations in DNA, as well as several specific fusion sites or breakpoints at the same time in a rapid manner. This ability to rapidly test large amounts of DNA was essential as we started the phase 1 study of lorlatinib, a third-generation ALK inhibitor. The fusion of ALK is nearly always with EML4 and at well-described fusion breakpoints. These facts allow DNA probes to be designed to cover those breakpoints with limited false negatives, identifying patients with a relatively rare genomic event. The ability to find a large number of patients and match them with an effective new treatment starting in 2014 led to the relatively rapid approval, in this case, the fastest in the manufacturer's long history, of lorlatinib to treat patients as a standard of care. Having treated a patient with CNS metastatic disease on lorlatinib for over a decade, I can tell you that this is life-altering for patients, family, and for us providers. As our knowledge has grown, however, we began to recognize that DNA-based technology might be missing some gene fusions simply due to less reliable or more promiscuous fusion partners. A classic example of this includes the NTRK gene fusions. Whereas ALK is relatively monogamous with the EML4, the 3 NTRK genes often fuse with many different partners. And this is complicated by large intronic regions in the genes that can be hard to sequence with DNA-based technology. Due to these two facts, DNA-based sequencing may not detect all NTRK fusions. Basically, if you don't know the specific street address of the fusion, you could miss it. This is where RNA-based sequencing enters the equation. Because RNA-based sequencing looks for the product of that fusion event rather than a specific sequence, it's less likely to miss a rare fusion event. This optimization was important to our work in the phase 1 study of larotrectinib, an NTRK inhibitor. Why was this so important? NTRK fusions are rare, really rare, and can be found in nearly any tumor type. Looking for NTRK fusions with a DNA-based test that misses some would have delayed the development of this drug, but more importantly, would have cost patients the benefit of such an agent. Remember, larotrectinib was the second drug approved by the FDA in a tumor-agnostic manner based on response rates of roughly 80% in a phase 1, phase 2 population. For any patient, the risk of missing a signal that is so highly predictive of a response to a well-tolerated agent is simply too great to not offer the most complete test. Due to the nature of NTRK fusions, RNA-based sequencing can be a reliable way to offer this benefit to our patients. I'm excited to have the chance to talk through the history of molecular diagnostics and the evolution to the current state-of-the-art in testing for our patients. Because I've had the chance to care for so many patients whose lives were impacted by lorlatinib, larotrectinib, and many other targeted therapies, I am passionate about helping my colleagues to better understand, implement, and utilize advanced testing to offer these sorts of outcomes to their patients.